The America's Democrats podcast, a project of 21st Century Democrats, is made possible by contributions from our listeners. Want to do more? Go to Americans.Democrats.org and click Donate. And thank you for allowing us to be your voice. And if you enjoy the show, please share it with your friends on Facebook and Twitter, and leave us a review on your favorite podcast app. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. I'm your host, Jim Cuddy. This week, why doctors are leading a movement to cover medical care for all Americans. Donald Trump's lasting impact on the highest office in the land. Plus, Bill Press talks with Stephen Greenhouse, author of Beaten Down, Worked Up, The Past, Present, and Future of American Labor. Had enough of Fox News, the House Freedom Caucus, and Donald Trump? If you want the facts that you won't get from them or from the fake news sites of the alt-right, then stay tuned. Our sponsor, 21st Century Democrats, works hard to get everyday Democrats involved in returning our party to its roots and to success at the ballot box. Sit back and listen, then stand up and fight, and follow 21st Century Democrats on Facebook for all the latest progressive news. We're glad you can join us. As a physician, Dr. Susan Rogers knows well the daily failures of a profit-driven healthcare system and the inequities it creates. That's why she says only a single-payer system can provide the kind of healthcare all Americans deserve. And we say hello to Dr. Susan Rogers, General Internist and President-elect of Physicians for a National Health Program. Dr. Rogers will assume the role of president starting in January of 2021. Dr. Susan Rogers, thank you so much for joining us today on the America's Democrats podcast.
Well, thanks so much for inviting me to talk to you today.
Well, certainly our pleasure to have you with us. The Physicians for a National Health Program supports a single-payer national health insurance. Remind us of how this plan would work.
Well, what we have now is what is called a multi-payer plan, and that is where there's multiple payers, meaning insurance companies with multiple policies. So it's a really fragmented, convoluted system. What a national health program would be, the single payer Medicare for All program, is one single payer, and that would be the government. And what it would be is an improved Medicare for all. Everyone would be covered. Everyone would have the same benefits, which would include all medically necessary services and also including long-term care, dental, ophthalmology, things that Medicare currently doesn't have. And that's how the plan would work. There would be one payer, one system. There would be no networks. Everyone would have the choice of where they want to get their care. They can go to any doctor they would like, go to any hospital they would like. There's no copays, no premiums, nothing. And it would cost cheaper, much cheaper than what we're spending now.
You know, surveys show that most doctors would welcome a plan such as this. In terms of what doctors see their patients experience, what leads them to support the idea?
Well, one of the things that happens when you see a physician and then you have a complaint and then the two of you would decide on whatever course of treatment, any kind of diagnostic tests, whatever, and you decide on that. However, what happens is that it's really up to the insurance company whether they will pay for what you and your physician have decided needed to be done. So this involves a lot of administrative time on physicians having to talk to insurance companies to get their plan covered, so that it creates an unnecessary barrier to care by having this insurance company as a go-between. Keep in mind, the insurance company offers no care. It is strictly just a middleman in this whole scheme. And so doctors would be able to see more patients because they wouldn't be tied up spending all this time doing administrative duties. They wouldn't have to hire someone in their office just to be a liaison with insurance companies. And another benefit that physicians really appreciate, too, would be it will lower their malpractice costs. A lot of times there are high multi-million-dollar awards in malpractice cases because it has to cover the long-term medical care of the person who thinks they were a victim of malpractice. And even if it's really not malpractice, there's still long-term medical needs that some patients would have. And that those, you wouldn't have to have malpractice awards to cover those medical costs. It would already be covered by a Medicare for All program. So the only malpractice would be for punitive damages if those were awarded. So it would help address the malpractice issues that a lot of physicians face now.
Mm-hmm. You know, one thing that you've spoken about is the way health disparities endanger the lives of people of color. How can a single payer plan make a difference in terms of health disparities?
Well, one of the things that has happened is that our system now is profit-driven. It is based on providing care where you can make money versus providing care where it is needed. And right now we have communities that have no primary care physicians. They may not have a hospital any longer, and that's because they don't have the money or the coverage to pay for access to care. So what has happened now is you've created a two-tiered health system here. You have a system that people can access if they have the financial means, and then you have a whole other group of people who cannot access the care because they don't have the financial means. And this is just worsening a lot of the health disparities. People aren't able to take care of chronic medical problems because they can't access care. They don't get preventive care that they should have because they can't access it. And it just perpetuates the disparities that are already there, and it endangers lives because people cannot get the care they need. They become less productive. They are not as healthy. So, and one of the things people don't realize, too, is that when one group is suffering from disparities, it really affects the whole nation as a whole. It's to our benefit that everybody's healthy, that everybody is productive, that everybody can contribute. And our system right now does not do that. In poor neighborhoods, there's often not a hospital. There's, like I mentioned, not a primary care provider, plus the inability to pay for drugs. That, medications have now gotten so expensive that a lot of people can't afford it. So even if you know what you need to take to get better, you can't afford that.
And you see so many people heading to Canada or heading to Mexico or heading to Europe to get the drugs that they need because they can't afford to get them here in the U.S. And that's potentially dangerous.
It's ridiculous, and it's not necessarily dangerous to have to go to Canada to get the medicines because the medicines are exactly the same as what we have here. They are made by the same companies. They are in the same bottle. They're packaged exactly the same. It's just that the pharmaceutical companies charge us more because they can get away with it. Studies have shown if we were able to negotiate drug costs with pharmaceutical companies, Medicare would have saved $71 billion over the last 6 years if they had paid the same cost that the VA system here pays. So there's a way to decrease drug costs, and going to Canada really is not endangering anyone because it's the same medication.
We're speaking with Dr. Susan Rogers, President-elect of Physicians for a National Health Program. She'll be assuming that role of president starting in January of 2021. Susan, a new healthcare system also could have a tremendous impact on the way doctors do their job. How will a single-payer plan make it easier for doctors to do their job effectively?
Well, as I mentioned, if you take away the time that especially primary care physicians spend on electronic medical records and dealing with insurance companies and having to change prescriptions because the drug isn't covered by that insurance company, that is almost 25 to 40% of their time that they spend doing that. That's time that they could have spent with patients. They could have seen more people and, done what they were trained to do without this administrative overhead. We spend more time on administration than any other country. And if you just compare us to Canada, we spend almost 10 times as much time doing administrative duties than physicians in Canada. And it's this administrative overhead, this bureaucracy that is required of us to get the care that our patients need makes us much more ineffective. It's leading to a lot of burnout. It's leading doctors to quit clinical practice. So single payer would take away all of this, and doctors could do what they want to do, and they could do it much more effectively.
Well, of course, there are always going to be opponents, and opponents of single payer often say we cannot afford it. And you started to address this a little bit earlier. How do you respond to somebody who is an opponent and says, no, we can't afford to do this?
Well, we actually can afford it. There have been 27 studies by leading economists that have shown that we can afford this. Even the Koch brothers did a study that showed that Medicare for All would spend less money than what we're paying now. Hospitals spend 25% of their income on administration. Right now, there are more billing clerks in a hospital than there are nurses. And this is where money and energy is going, into this whole administrative abyss created by insurance companies. And we can afford it. What would happen is that we would have a small tax or a payroll deduction instead of high premiums. And one of the things that this would do is that it would allow labor to negotiate for higher salaries. That we would be able to, let me interject, but one of the things is that the government is already spending more than every other country other than Switzerland. We spend more government funds for health care than all other countries other than Switzerland. And this is because we pay for all of this administrative overhead. And if we took those dollars that we're already paying, we could cover everyone with the addition of this small payroll tax. So everybody but maybe 5% of the country would pay much less than what they're paying. And we would have no out-of-pocket expenses. Even if you had an unexpected medical issue, it would not cost you anything. Right now, people are going bankrupt because of unexpected medical issues and medical bills. So that it's been proven by economists that this system, Medicare for All, would cost us less, and everybody would be happier and everybody would be healthier.
And a single payer plan would replace the Affordable Care Act. How would it be an improvement?
Well, it would be an improvement because right now the Affordable Care Act is still based on private insurance companies. Much of the money that goes to those private insurance companies is coming straight from the government and subsidizing these plans. And the Medicaid expansion is paid by the government, so that a Medicare for All plan would still cover everyone and that it would make the system work.
Given the opposition to single payer, especially from the private insurance industry, of course, are you hopeful that single payer can succeed?
Yes, I am, because what we have to do is try to dispel some of the myths and some of the arguments that they are making. Insurance companies try to emphasize that people need to have choice. Well, what you want to choose is a system that would cover all of your medical needs. That's the only choice everybody has. No one knows what their medical needs are going to be in the future. So you want to be covered for everything. And that's what Medicare for All would cover. There would be no additional copays. You'd have your choice of doctors, hospitals. Right now, you don't have that choice. And even if you have a plan that you like, you don't know if that plan is going to be there next year when your employer renegotiates contracts. You don't know if you'll have that same job the next year. And the other thing to remember is that if you get too sick to continue working, you will not have any insurance. So how is whatever made you sick going to get taken care of? And that's what Medicare for All would be. So that's the argument that I like to make, is that in all situations, it's a better choice. We will have choice. And keep in mind, too, that this is not a government takeover of health care. This is a government-funded but publicly delivered service so that the private doctors who are there will still be private doctors. Hospitals will still be freestanding hospitals, but we could now put services and physicians in places of need rather than where they can make money.
You know, it seems to me oftentimes messaging is the problem, and good policy gets lost in bad messaging. And the way that we've talked about it here today, it seems to me that you could probably sway a great deal of opponents of the single-payer system, just as you explained it to us today. I mean, it just makes complete sense to me, and I don't understand the continued pushback.
Well, people use words like socialism, that this is a socialist system, and actually it is not anywhere near a socialist system. A socialist system is government run and government delivered. That is not our system. The VA is actually a socialist system, which, by the way, has better outcomes than a lot of these private hospitals have. And, you know, they use code words like you want to have a choice. But, you know, when you think about it, you want to be covered for everything. It's no different from your car insurance. You would not choose, do I want to cover the right side or the left side of my car? I want the whole car covered. And we want all medical possibilities covered by our insurance.
Absolutely. Dr. Susan Rogers, President-elect of Physicians for a National Health Program, joining us today on the America's Democrats podcast. Dr. Rogers, thank you so much for your time with us. We'd love to have you back again soon and talk some more.
Oh, I would love to be back. Thank you so much for asking me to talk today.
You're quite welcome. And this is the America's Democrats podcast, the weekly podcast for stand-up Democrats. We want you to sit back and listen to this Americans.Democrats.org podcast, a project of 21st Century Democrats. But we need you to stand up and fight. Do you want to get involved and help get our party back to its roots and to success at the ballot box? You can make your contribution to help us keep this show going and to elect Democrats who will stand up for democratic principles. Go to Americans.Democrats.org and click on Donate at the top of the page.
Social Security measure. I believe that we must pass legislation to provide medical care.
This is our tradition. When our grandparents came to America, it was the Democratic Party which said, welcome. It was the Democratic Party, the party of Roosevelt and Truman and Kennedy and others, who said that America belonged to all its people, not just a handful of the rich or a few giant corporations. That's why great leaders like FDR fought so hard for Social Security, and why JFK stood up to the insurance companies and their Republican allies to get Medicare. It's not just one thing, or one time, in one place. It's about a whole history of standing up to the Republicans and saying someone has to be on the side of regular working people in America, whether it's defending Social Security or just the way your loved ones are treated on the job. That's what the Democratic Party is all about. And that's why this message has been brought to you by the Democratic Party. Working people like you and me.
Paid for by 21st Century Democrats. Not authorized by any candidate or candidates committee. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. Coming up next, a damage report from inside the Oval Office. But first, we turn to Jim Hightower, America's #1 populist, for his common sense commentary.
As an old saying puts it, where there's a will, there are 1,000 won'ts. Sure enough, here come the won'ts, opposing the public's demand for bold action to stop inequality. The corporate powers are frantically trying to scare the public away from big ideas like Medicare for all, free college tuition, and a wealth tax by branding them with a hoary old right-wing bugaboo, socialism. However, they're facing one huge problem in selling this scare tactic. Such progressive ideas are quite popular. A July poll shows that Senator Elizabeth Warren's idea of a new tax on fortunes greater than $50 million is favored by 2/3 of Americans, including 55% of Republicans. Nearly 6 out of 10 people favor Medicare for all, including a majority of high-income Americans. And nearly 60% of us, including 72% of independent voters, favor free tuition. Ironically, the major barrier to passing such changes is not the one thrown up by big-money lobbyists and Republican Congress critters. Rather, it's the meekness of establishment Democrats who don't have the courage of their party's Democratic convictions. They whimper that it will be hard to pass the sweeping changes Americans need and want. Plus, those ideas might offend some of the party's big donors. So rather than respond to the grassroots will for real change, these weak-kneed forces are opposing strong advocates like Warren and Bernie Sanders. They say the party should back off from its core values and fighting spirit, urging it instead to offer small, incremental adjustments in the status quo that might win support from some Republicans and corporate chieftains. This is Jim Hightower saying, if the meek ever inherit the earth, these timid do-nothings will be land barons. If Democrats don't stand for the people, why should the people stand for them?
If you'd like more of Jim Hightower's real populism, check out the Hightower Lowdown. Jim's monthly newsletter gives you the real lowdown on which corporations, by name, are doing what to the middle class, our environment, and our democracy. Each month, the Hightower Lowdown brings you facts you didn't know, along with actions you can take to fight back. It also comes with a sense of humor. Hightower believes we can fight the gods and still have fun. Plus, get this, it's cheap. Only $15 brings you 12 issues a year. For real populism, go to hightowerlowdown.org.
This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. A new book from Benjamin Wittes and co-author Susan Hennessey offers a piercing analysis of Donald Trump's presidency and a compelling argument that he is transforming the nature of the office. Wittes says that as Trump continues to put his personal interest ahead of the public good, the future of Democratic governance is at risk. And we say hello to Benjamin Wittes, editor-in-chief of Lawfare and a senior fellow in governance studies at the Brookings Institution. He's also co-author, along with Susan Hennessey, of Unmaking the Presidency, Donald Trump's War on the World's Most Powerful Office. Benjamin Wittes, thank you so much for joining us today on the America's Democrats podcast.
A pleasure. Thanks for having me.
Our pleasure to have you with us. The premise of this book is that the president has elevated the expressive and personal dimensions of the office over everything else. Tell us more about what that means.
You know, people often resist the idea that Donald Trump has a theory of the presidency or is advancing a vision of the presidency because he's so inarticulate and because he clearly is not a theorist. But our thesis is that when you systematically violate as many norms as he has over a protracted period of time, whether you know it or not, whether you mean to do it or not, you are actually proposing an alternative. And so we mean in this book to take seriously the idea that Trump is proposing a different vision of the presidency. And that vision, we argue, is one that conflates the personality of the office holder with the office itself and sublimates all of the traditional management functions of the executive branch, all of the public service dimensions of the executive branch, to the expressive functions that we associate with the presidency, the sort of public speaking, the doing things in public, in Trump's case, the tweeting and the press statements. All of this is, in the traditional presidency, in the service of some management function. And in Trump's case, it really is the sum total of his ambitions with respect to the office.
What are some examples of how he has put personal inclinations over broader concerns and interests?
Well, think about the first week of the Trump campaign, of the Trump administration. He takes the oath of office where he solemnly swears to faithfully execute the office of president and to preserve and protect the Constitution. And his first thing that he does is have a fight over the images of crowd sizes at his inauguration, right? And he is incensed that the National Park Service tweeted pictures of his inauguration crowd next to Obama's inauguration crowd, and Obama's was clearly larger. And so he orders the Interior Department to stop tweeting, despite the fact that the National Park Service uses Twitter for communications in emergency situations, to deal with mudslides and, disasters. They have offended the president's personal interests, personal vanity. And so they are directed to stop using their Twitter feed. And that is an example of right in the aftermath of swearing the oath of office, how he is, putting the management functions, sublimating the management functions of the president to the sort of what we call the vanity plate elements of the presidency. That is, what the public sees, what the public gets shown the president doing. Another example is the way the president himself uses Twitter. Presidents have at various times in American history had very different conceptions of what the right way to talk to the public is, or even in the early republic, whether they should be talking to the public at all. Trump is doing something else. It is a constant barrage of hearing from the president. The public is hearing from the president on a almost hourly basis, in often very personal terms, in often very dramatic and flamboyant terms. No other president has used public communication in quite this way.
Is there any possibility that the founders could ever have imagined a president such as this and put in place systems and structures to guard against him? I mean, obviously they can't foresee Twitter, but just the equivalent of the way he communicates.
So the founders were actually extremely concerned about demagoguery, and it was a particular worry of Alexander Hamilton, and it's one of the reasons that we have the Electoral College. The idea was that if you let the public elect a president directly, somebody like Trump, who appeals to the sort of baser instincts of the population, who will promise all kinds of things, will be able to sway a potentially temporal majority into electing him. And so the founders imagined, all right, let's set up to prevent exactly that outcome. Let's set up a kind of intermediary institution where the people will elect electors who will then choose a president. And by the way, the electors may not give the people the demagogue they want. They'll act as a kind of protection against that. And of course, the irony is that the system functioned in exactly the opposite way as it was imagined. The public voted for Hillary Clinton by a margin of some 3 million votes, and the Electoral College, installed to prevent the public from electing a demagogue, replaced the public choice with that of a much more demagogic figure. So I think, yes, the founders did imagine this problem and actually took steps to prevent it. But the steps that they took, at least in 2016, really backfired.
Mm-hmm. We're speaking with Benjamin Wittes, editor-in-chief of Lawfare. He's co-author with Susan Hennessey of Unmaking the Presidency, Donald Trump's War on the World's Most Powerful Office. Benjamin, as you explain, one of the consequences of this style of governing is that bureaucrats from cabinet secretaries on down find themselves making statements and even policies that differ from what we hear from the White House. What are the dangers here for the American public?
So there are a lot of dangers, and some of them in the short term are pretty attractive, right? So the conundrum here is that Trump has all kinds of crazy ideas. He wants to do all kinds of crazy things, and he is stymied by the fact that, people below him just kind of ignore him a lot of the time. And, the president says, we're going to do X, and the Secretary of Defense says, no, we're not. Secretary of State actually testified in a congressional hearing that what the president says is not policy. And on the one hand, all of that is really attractive because it prevents the craziest aspects of Trump from becoming realities in ways that would be very dangerous. But on the other hand, as a matter of democratic governance, it's pretty toxic stuff. Having the executive branch is supposed to be a vertically integrated hierarchy with the president at the top. And it's supposed to be, the president is the one who's elected. Nobody elected the Secretary of State. Nobody elected the Secretary of Defense. And to have a world in which the president actually doesn't run the government, but is kind of the mascot of the government, that is a world where democratic accountability really is diminished. And so you saw a really dramatic example of this during the impeachment investigation, where large numbers, 17, I believe, government officials are subpoenaed by the House. The president orders them not to testify, and they do it anyway. And to which I say, great, it is really good that members of the administration stood up to the administration and told the truth to Congress. That is exactly the way you would want it to be. And yet, you also want an administration where the president has the stature that his underlings actually follow a directive as to how the executive branch should engage with the legislative branch. And so, look, in the short term, this is the disobedience, the fracturing of what is traditionally called the unitary executive is a very good thing. In the long run, it gives rise to habits of disobedience and habits of that make governance very, very difficult.
Well, and you write about how the president's staff regard him as a toddler and how they've devised any number of strategies to manage him. But, I mean, shouldn't we take heart that there are at least some grown-ups behind the scenes?
Yes. I think it is an unqualified good thing that lots of things that Trump wants to do are being stymied by his staff and by cabinet secretaries. However, if you ask the question, is this the way the executive branch should work? Do you want an executive branch in which unelected cabinet officers, unelected staff actually defy the elected hierarchy of the country? The answer to that is no. And so I think it's a situation that puts us all in a very difficult position. If you imagine, for example, that Hillary Clinton had won, would you want her cabinet behaving the way this cabinet does? Would you want a national security staff behaving the way this national security staff behaves? And the answer is absolutely not. It's not the way a government should function.
Yeah. Well, then, to think about this a little further, the consequences in the arena of foreign affairs, where what a president says can reverberate in powerful ways, how have you seen this play out?
So Trump's foreign policy behavior, leaving aside the merits of his foreign policy ideas, his behavior is exceptional in two respects. One is how impulsive it is. In American history, there really aren't a lot of examples of presidents behaving on fateful matters in a highly impulsive way, right? They go through a policy process, they consider lots of views, but it's not an adaptive thing to have a phone call with, for example, the president of Turkey and say, okay, we're getting out of Syria, right? And that is not an adaptive way to behave. The second feature that's really distinctive on Trump's part is just how outlying some of his foreign policy ideas are relative to a mainstream that is pretty well understood within the two parties. So it is a pretty common thing for presidents to, take foreign policy actions that are controversial across a partisan divide. For example, President Bush's decision to invade Iraq was highly controversial, right? Many people opposed it. That's a relatively common thing. it is a highly uncommon thing for presidents to defy foreign policy consensus. And, there was a pretty settled consensus across party in U.S. foreign policy about Russia being an adversary power. Vladimir Putin is not our friend. Trump has acted in a consistent way in the face of that consensus. South Korea is our ally, right? Trump has acted, there are just very few people in either party who doubt that. Trump has really moved to destabilize that understanding. That sort of action, particularly highly impulsive action in the face of broad bipartisan consensus, is very, very unusual in foreign policy, relatively typical of Donald Trump.
And not to mention downright scary. Benjamin, you also devote a chapter to law enforcement titled Corrupting Justice, and you describe this president's quote-unquote war against the orthodox understanding of law enforcement. What is his vision of law enforcement, and how successful has he been in realizing it?
Well, it's the verdict is still out on the second question. Trump has a very simple and very crude vision of law enforcement, which is that the role of law enforcement is to go after his enemies and protect him and his friends. And you don't have to believe me on that, because he says it all the time. Trump dismissed the FBI director, Jim Comey, because he didn't like the fact that Jim Comey wouldn't announce publicly that Trump wasn't personally under investigation in the Russia investigation. He dismissed the Attorney General, Jeff Sessions, because Jeff Sessions had recused himself in the Russia investigation, and as Trump put it, he was supposed to protect Trump. He also has complained very loudly that the Justice Department and the FBI aren't going after Hillary Clinton and Jim Comey and the treasonous people in the FBI, his word, not mine, who conducted the Russia investigation. In fact, he is very open about the fact that he understands the role of law enforcement as a kind of palace janissary guard whose job it is to help him and harm those or investigate those who oppose him, which is, of course, the issue that arose in the Ukraine affair, where he took that view not merely toward his own law enforcement, but toward Ukrainian law enforcement and the foreign policy authorities of the president to try to influence Ukrainian law enforcement.
Well, thankfully, at some point, Donald Trump will no longer be president. But are these changes that he's brought to the office likely to be long-lasting?
So I think the answer to that depends necessarily on the circumstances in which he leaves office. If you imagine that he is defeated soundly in the coming election, you would understand that electoral result, particularly given the strong state of the economy, to be a real repudiation of Trump's vision of the presidency. And I think the lesson future presidents might learn under those circumstances is this sort of behavior, it may work for a little while, but actually people want more decency, more civic virtue, more public spiritedness in a president than that. Mm-hmm. If, on the other hand, you imagine that he is reelected, re-election is the form that our system has of ratification of change to the presidency. The presidency is not a static institution. It changes over time. The modern presidency is very different from the early 20th century presidency, is very different from the 19th century presidency. And the mechanism by which the office changes is that presidents define norms, push the boundaries of what the office can do and should do and is understood to do, and people ratify it by reelecting them. And so I think if you imagine that Trump is successful in getting reelection and in governing in a second term, people will take that as the proof of concept that this kind of vision of the presidency actually works. And so I do think we should think of, what is on the ballot in November, not merely as, do you like his policies? Do you dislike his policies? Do you like him personally? Do you find him offensive personally? It is all that, but it is also, is this a vision of the presidency that you want to catch on, or do you want it to be relegated to a kind of historical asterisk or footnote?
I can only hope that the major portion of the electorate will understand this to be, we need to change and we need to get back to decency and proper leadership. Benjamin Wittes, editor-in-chief of Lawfare, senior fellow in governance studies at the Brookings Institution, joining us today on the America's Democrats podcast. He, of course, is also co-author with Susan Hennessey of Unmaking the Presidency, Donald Trump's War on the World's Most Powerful Office. Benjamin, thank you so much for your time with us today. We do appreciate it and look forward to hearing back from you again soon.
Thank you. It's been a pleasure.
Thank you very much. And this is the America's Democrats podcast, the weekly podcast for stand-up Democrats. We want you to sit back and listen, but we need you to stand up and fight. Help get our party back to its roots and to success at the ballot box. Make your contribution to keep the Americans.Donald.org podcast, a project of 21st Century Democrats, on the air, and help elect stand-up Democrats. Go to Americans.Democrats.org and click on Donate at the top of the page. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. Are unions making a comeback? Bill Press talks with author Stephen Greenhouse on the past, present, and future of American labor.
So the state of unions, I'd say, is mixed. On one hand, unfortunately, the percentage of workers in unions continues to decline year after year. We just learned in January that the Bureau of Labor Statistics said that percentage of workers in unions has dropped to 10.3% from 10.5%. That's down from a record, peak of 35% in the 1950s. And in the private sector, only 6.2% of workers are in unions. That's just 1 in 16. That's the lowest of any industrial nation. So in that sense, things are bad. Also, even though Donald Trump promised in giving away the $1 trillion tax cut to corporations that wages would be up healthily and nicely, wages really aren't going up very much at all, which is especially surprising when the jobless rate is so low. On the good news side, why I say it's mixed, Bill, is that workers are really waking up. We're seeing a lot more activism than we saw 2 years ago. We've seen the teacher strikes in West Virginia, Oklahoma, Arizona, Los Angeles, Chicago, the Marriott strikes in 8 cities, the Stop and Shop strike in New England, and the biggest of all, with the GM strike. So workers are frustrated. They're acting up. Even elite white collar workers, like 20,000 Google workers, went on strike for a few hours to protest how badly Google management was handling sexual harassment cases. And other promising things that are happening is, all the Democratic presidential candidates have been outspokenly pro-union. They put forward, these very pro-union platforms. You might expect that from Bernie and Elizabeth Warren. Buttigieg has a great pro-union platform. Biden, of course. Booker had one, and so that's good. Also good is we're seeing a real wave of interest in unions among young people, grad students, adjunct professors, nurses, and lots of folks in our profession, news, the digital media. Slate and Salon and Huffington Post have unionized. The most anti-union newspaper in the country, the LA Times, is unionized, the second most anti-union paper in the country. The Chicago Tribune has unionized. So things are rebounding in many ways. Now, whether it could be translated into much bigger numbers is the big question. I'm working on a story right now about a union here in New York that's unionized 15,000 airport workers in New York, Boston, Washington, Philadelphia, and Florida. So unions are getting their act together, but not enough unions are really moving forward at the same time.
Well, in your book, Beaten Down, Worked Up, you talk about some of those positive things, those exciting things that are happening in the labor movement. And you also indicate there are a lot of reasons why the percentage of membership has gone down. Tell us about a couple of them. I mean, it seems to me that too many people don't recognize what unions have meant for American workers, what they've brought to the American workers. And today, too many people maybe want to take all of that for granted, like they want something for nothing.
That's a great question, Bill. So when I go around the country giving speeches about my book, I say one of the reasons I wrote this book is that far too many Americans, especially young Americans, know far too little about labor unions and what they've accomplished. Like, thanks to labor unions, we have pensions and employer-sponsored health coverage
and a weekend
and paid vacation. And I love the bumper sticker unions, the folks who brought you the weekend. And I say that a lot of young people seem to think that the 40-hour work week was handed down by God. And I explain no. It was won through decades, not years, but decades of struggle by workers and their unions. In my very first historical chapter, I write about a famous strike here in New York City by 20,000 female garment workers called the Uprising of the 20,000, where the cops and hired thugs beat the fill in the blank, beat the bejesus out of these 17-year-old, 19-year-old, 20-year-old female garment workers. It was horrendous. And they were fighting not for a 40-hour week. They were just fighting to reduce their work week from 56 hours to 52 hours. So it's, the unions have done a huge amount in improving the lives of Americans, and unfortunately a lot of people don't realize that. And as unions have become more powerful and raised wages and gotten better benefits, corporations in many ways have grown less happy about that. So you ask, why has the percentage of workers in unions declined? I think there's several reasons. I think, a big reason is that the number of manufacturing workers in the U.S. has declined significantly, and unions were the core, the base of organized labor. We went from having, it used to be 1 in 4 workers in the U.S. was a manufacturing worker. In 1979, at the peak, there were just under 20 million manufacturing workers. That has fallen to just over 12 million. So it's been a fall of about 40%. So I think that explains a lot of the loss. In my book, I argue that the biggest reason the percentage of union members, the absolute number of union members has declined, is that corporations in the United States fight harder against unions than corporations in any other industrialized country. And they really play hardball. I have an anecdote about Menards, which is a home improvement company based in Wisconsin. And they had a clause in managers' contracts and store managers' contracts that if those managers' stores unionized, the managers would have their pay cut by 60%, 60%.
Wow.
So imagine the lengths, illegal and legal, that the store managers would go to in order to fight unions. I have another anecdote. I once interviewed a Walmart store manager from Louisville, and he said one day he went into the men's room in his store, and there was a little flyer saying, Walmart needs a union. So he followed Walmart rules, and he had to call the Walmart hotline to say, there's union activity in my store. And lo and behold, the next day, a corporate jet flies in from Walmart headquarters with 3 people in their crack anti-union team to snuff out any interest, any activism for the union. There's a terrific professor up at Cornell School of Industrial Labor Relations, Kate Bronfenbrenner, has really been the expert in studying the techniques employers use to beat back unions. And in her study, where she surveyed union organizers, she found that 57% of employers in the U.S. threaten to close operations if workers vote to unionize. 47% threaten, believe it or not, to cut wages and benefits if workers vote to unionize. They say if you unionize, things might end up worse for you. And her study also found that 34% of corporations fire rank and file workers who support unions to take the wind out of unionization drives. And her study also found that 28% of companies seek to have, plant spies to infiltrate the union organizing committee. So, American corporations fight very hard, to crush unions. And there are other factors I should, of course, mention, Bill, that there's been, corporate America is focusing far harder than it did, decades ago to maximize profits,
right,
minimize labor costs. I think that's also gotten them to focus more on defeating unions. Some people talk about the financialization of the economy as Wall Street and hedge funds have more power over companies, and they also press companies to do their utmost to reduce costs and weaken unions. Then deregulation under Jimmy Carter and Ronald Reagan, really hurt the Teamsters Union, the truck drivers, telecommunications airline unions. Ronald Reagan's famous or infamous crushing of the air traffic controllers strike.
Right. I wanted to ask you about that particular action by Ronald Reagan back in 1981.
Let's go back to that in half a second, because someone's going to criticize me for not mentioning the following. And unions have screwed up in many ways, in some ways, and that has also hurt their cause. There was, as anyone who saw The Irishman knows, there has been too much corruption in the labor movement, but there's far, far, far less corruption now in the union movement than there used to be. And I argue now that there's far more corruption in the White House nowadays and in the Trump administration than there is in labor unions nowadays. Plus, unions have a legacy, unfortunately, of discriminating against women and workers of color. Again, they've gotten infinitely better on that, and that's all to the good. And unfortunately, some unions aren't doing enough organizing. Their leaders don't have enough vision about how to build for the future. But there are, some really good unions. The Service Employees Union, the Steelworkers, AFSCME, are really, doing a lot. The Hotel Workers Union and a lot of others are doing a lot of organizing. That's all to the good. So we were going to go back to Patco. So.
Well, so back to you touched on so many things there. I'd like to hear more about, but just to mention that Ronald Reagan. I mean, in 1981. I mean, he broke the back of the air traffic controllers, and that's had a huge impact, hasn't it, on ability to organize or willingness maybe even to organize.
Absolutely, Bill. So I devoted a chapter in my book to that. And, one of the crazy things was, Ronald Reagan used to be president of the Screen Actors Guild. And he was the president of the Screen Actors Guild when it went on its very first strike. He was a very conservative guy. He wasn't seen as usually pro-labor, but people thought he would be somewhat sympathetic because of his union background. And the air traffic controllers were one of the very few unions that actually endorsed Reagan over Jimmy Carter in 1980. And they had, very exorbitant demands. They wanted raises of 30, 40, 50% while going from a 5-day week to a 4-day week. And they expected Reagan to do all sorts of favors for them because because they had endorsed him. And they went on strike. 13,000 went on strike. They thought they could totally closed down the nation's airports, and Reagan would cry uncle, would surrender and give the union what they wanted. But, for Reagan, when the air traffic controllers went on strike, and it was an illegal strike because federal workers aren't allowed to go on strike, it became kind of a make my day moment. It really gave Reagan and a lot of anti-union people in his administration opportunity to say, make my day. And Reagan told all the striking air traffic controllers, if you don't come back to work within 48 hours, you're fired. And he fired 11,700. And it was a disaster for that union. It was a disaster for the union movement. In retrospect, a lot of leaders from other unions say that the air traffic controllers really screwed up. They didn't gauge public sentiment. The public was hugely against them. They didn't work closely enough with other unions for union support. They really went in their own solitary way, and they pissed off a conservative president who, in his first few months of office, was trying to show his strength. And, the defeat of the air traffic controllers union really sent a big message to corporate executives that, hey, it's time to get tough against unions. And what Reagan did also sent a loud message to labor leaders saying, be careful about being militant, be careful about going on strike, because management could crush you.
Right. Now, so that leads to the question, and you talk about this in your book too, that strikes today are much, much more rare than they used to be. And you just said something a little earlier about maybe some of the labor unions got too, maybe a little too tentative or a little too afraid of calling a major strike because of what happened to the air traffic controllers. But are strikes still, you mentioned the GM strike, for example, strikes still effective, and why are there so few strikes?
So in the 1940s and 50s and 60s, many years there were like 200 strikes by more than 1,000 workers, or even 300. So there were a lot of strikes. Over the past 10 years or so, we've gone down to just averaging 13 major strikes a year.
A year.
And I think what happened in the 1980s was that not just Reagan beat the air traffic controllers unions. The other companies, Greyhound, the International Paper, they really crushed unions during big strikes, and because companies were using much tougher tactics, they were locking out workers, they were permanently replacing workers who go on strike, basically taking away their jobs. The United States is the only industrialized country of 30 industrialized countries where corporations are able to permanently replace people who go on strike, and that people became much more worried that, hey, if I go on strike to seek a 7% raise over 2 years, I might lose my job. Is it worth it? And companies played much harder ball against strikes. So I think that was the main reason. Another big reason, Bill, was that, in the 1980s, we really saw the rise of globalization and foreign competition. And a lot of companies were moving factories abroad. And again, workers worried that, hey, if we're too militant, if we go on strike, that might just hasten the decision by our employers to move operations to Mexico or China or Vietnam or Bangladesh. So, but in the past 2 years, there's been this surprising rebound of strikes. I'll tell you a story very quickly. So I turned in the original draft of my book on Monday morning, February 19th, 2018. And it was a fairly quiet time for labor. There wasn't much really percolating except for the Fight for 15, which really accomplished a lot. That was not traditional unions going on strike. It was fast food workers going out for one day at a time. So 3 days later, on Thursday morning, February 22nd, there was this volcanic explosion in the state of West Virginia where thousands of red-shirted teachers went on this huge strike, 20, 30, 40,000 teachers. And that really signaled a reawakening of labor. The baton was passed from there to Oklahoma, to Kentucky, teachers in Denver, teachers in Oklahoma, then in Arizona, then Los Angeles and Chicago. And I think that the successes of the teachers helped spawn the Marriott strike in 8 cities, the Stop and Shop strike. There was a Mack truck strike. There was a General Motors strike. And now we're seeing, and then this month, in January, there's been a strike in 7,800 nurses and healthcare workers in Washington State at Swedish Medical Center have gone on strike. So there is a rebound in labor militancy. So why? That's a big question. I think workers felt that, we're in the 10th year of a supposedly great economic recovery. We have a president shouting that he's made America great again. And a lot of workers are saying, well, things ain't great for me. My wages are just going up a tiny bit. Corporations are boasting about record profits. Again, Trump boasts every other day about how the stock market has hit record levels. And I think a lot of workers feel that they're not getting their fair share. The teachers, they see the legislatures of West Virginia, Oklahoma, Arizona cutting taxes for the rich, cutting taxes for corporations, and that's starving their school budgets. The teachers, in West Virginia didn't get a raise 4 years in a row. In some of the other states, they didn't get a raise for 10 years in a row. And they said, this is insane. And the only way to really change this is to stand up and go on strike. So I think the General Motors workers, they took all sorts of concessions to help bring General Motors out of bankruptcy during the Great Recession. And, they took many years of pay freezes. They agreed to a two-tier wage system. They saw several plants close. and they said, we scratched GM's back big time, but GM has done very little in terms of giving us raises, and it just closed this huge, important Lordstown plant. And they said, we got to fix things. And they wanted to send a strong message to GM that, you can't push us around. We want to be treated with respect, and we want our fair share of the huge profits that you're enjoying.
So do you see a renewed, you mentioned Fight for 15, the AFT, the teacher strikes, and the GM, the UAW. Do you see a new emphasis or a renewed emphasis on organizing among labor unions, spending more time, more activity, putting more people out, to recruit new members?
Yes and no. I mean, for some unions, yes. Yeah. Some unions,
but that's the key, isn't it? I mean,
some unions are really doing it. Others are still not doing enough. And as I mentioned, the Service Employees Union has organized, 15,000 airport workers on the East Coast. They're trying to unionize airport workers now elsewhere. I'm saying these are the low-wage people, the baggage handlers, the wheelchair pushers, the security guards, the private security guards who help the airlines, the folks, the cabin cleaners who clean the planes. Many of them are just getting paid $8, $9 an hour. And the unions here in New York and New Jersey got the Port Authority of New York and New Jersey to pledge to pay a minimum of $19, require companies to pay a minimum of $19 an hour for 40,000 workers. And this has really jazzed workers. And many of them say, look what the unions accomplished for us.
Right.
We want to do that. It's a little like the CIO, Congress of Industrial Organizations in the 1930s and 40s. People would say, look at all these spectacular gains that the CIO has won for workers. We want that. I have an anecdote in my book that when my mother, I was covering Scott Walker's war against unions in Wisconsin, in Madison, 2011. I was on the phone with my then 86-year-old mother, and she said, when I grew up during the Depression, and we saw, what the CIO did in organizing workers and the wage gains they had, we told ourselves, we want what the union workers have. We want to join a union, and she bemoaned that nowadays too often, at least with what Scott Walker was doing in Wisconsin, they've manipulated people to say, oh, union workers have too much. We want to take away from them what we have. And unfortunately, there's been this loss of solidarity. People say, instead of saying, we want to have what union workers have, we want to share the same gains, they say, oh, they got too much, we got to take away from them. So, again, part of the good news, and I don't want to sound like a Christian evangelist, but part of the good news is more Americans are feeling good about unions. In a poll that Gallup does, an annual poll about how Americans feel about unions, and in this year's poll, in the poll last August, it found that 64% of Americans approve of unions, which is nearly the highest level in 50 years. That's up sharply from 48% a decade ago. And in some especially good news for unions, the age group that feels best about unions is the 18 to 34 group, where 67% approve of unions. And other good news for unions is there's a study done by folks at MIT that said that basically 1 in 2 non-union workers say they'd like to join a union if they could. That's up from 32% basically to 50% in 20 years. So a lot of workers want to join a union. I think they're sick of income inequality. They're sick of corporate profits being at records while wages are not going up. I think a lot of young people feel, I'm graduating college with $40,000, $50,000, $60,000 in debt, and something's broken because I'm not making enough to begin to pay back my debt. And just as some workers unfortunately thought that Donald Trump would be their solution to their problems, I think they're looking to change the rigged system, and they see unions as an effective way to do that. So that's why I think we're seeing so much interest in unions nowadays. I get all these emails from young people saying, I'd like to form a union at my, at where I work. What do I do?
Bill Press talking with Stephen Greenhouse, author of Beaten Down, Worked Up, The Past, Present, and Future of American Labor. If you'd like to hear the entire interview, visit BillPressPods.com. And that's all for the America's Democrats podcast. Thank you to all who made today's show possible. Dr. Susan Rogers, Benjamin Wittes, and the entire Bill Press team. And thank you for listening. If you liked what you heard, please get involved in our efforts to keep this show going and to elect Democrats who are bringing the party back to its roots. Go to Americans.Donald.Trump and click on Donate at the top of the page. And be sure to find 21st Century Democrats on Facebook and Twitter, and leave us a review on your favorite podcast app. For the America's Democrats podcast, I'm your host, Jim Cuddy. We want you to sit back and listen, but we need you to stand up and fight. Join us. Support the Americans.Democrats.org podcast, a project of 21st Century Democrats, and help elect Democrats who will stand up for democratic principles with your contribution today. Go to Americans.Democrats.org and click on Donate at the top of the page.